Welcome to the Career Ready podcast. Learn about resumes, cover letters, LinkedIn, interviewing, and all the things you need to be career ready with the Career Services Center at College of DuPage. I'm your host, Jordan Rembrecht, for today's episode. In addition to learning about resources and the job search process, an important part of being career ready is understanding different career paths. To help us explore the field of respiratory care, I have Christa Brennan with me, who works as the Program Director for Respiratory Care here at College of DuPage. Christa, thanks for joining me for today's episode.
Thanks for having us, Jordan. We're excited to share about our program.
Awesome. So before we get started, can you please share a short introduction, or as we'd like to call it, your elevator pitch?
Sure. I've been a respiratory therapist for almost 20 years. Right after graduation, I went right into working with neonatal and pediatric population. So we would typically qualify that as anybody under the age of 18 would go into a pediatric hospital. I've served on transport team at several different hospitals where we will pick up children that are 6 months of age or younger and then transport them back to our hospital to either their NICU or the PICU for more advanced specialized care. After it was a little more than 10 years providing direct patient care, I moved into project management for a short period of time. While I was in project management, I was working with different respiratory projects for a small company, helping to build the product lines and kind of iron out some kinks to make it a more seamless process. And then I started teaching here at COD in 2019, and I've been here since then.
Awesome. Thanks for sharing. I always love hearing, all faculty's different perspective. You've had 20 years in the field, you've served on a couple different teams, and it's prepared you for obviously a great career here at College of DuPage. Did you start off as a part-time adjunct faculty at College of DuPage?
I did, but I came in at a really odd time. I came in halfway through a semester, and then I came in halfway through the semester. I was working as what we call a director of clinical education. Our program has 2 full-time faculty members. So we have a program director and then a director of clinical education. And then I got hired on full-time the next semester.
Awesome. Well, we're very lucky to have you. Can you talk a little bit about the respiratory care field and the different career paths that it can lead to?
Absolutely. A career in respiratory can lead to a number of different paths for our students to choose from, which I really love because there's a place for everybody in respiratory, no matter if they really want the hustle and bustle of critical care or if they kind of want to slow down and work like an acute care floor or work in like a rehab facility. Most of our graduates will have to put in time with direct patient care to be able to progress into the different areas that they can move into. But what's really unique about our program is that most of our new graduates, if they want to, are able to move into critical care very quickly, sometimes even right away, where that means they'll graduate, they'll go through an orientation with their hospital, and then they'll be working in critical care right away, which is kind of what a lot of people are drawn to respiratory for because they want to get into the critical care. They want to work with those really sick patients. So our team will staff in emergency departments, will staff in intensive care units, we'll call that an ICU. In our ICUs, depending upon the size of your hospital, you might have a neurological ICU, a medical ICU, a trauma ICU, or a cardiac ICU. In addition, you can then work directly in pediatric hospital where you can work in the NICU and PICU, which is where I started. But again, like I said, if the hustle and bustle of critical care isn't appealing, our students have to go through critical care clinicals in those areas. But after graduation, if they feel like, gosh, that's really not the area I want to be in, they're able to work in acute care areas within a hospital, which is going to be like a general medical floor. So it might be ortho patients. Maybe it's patients that were in the ICU, but they're no longer critical, so they're being transferred out. We might work in cardiac units. So there's a lot of different units that aren't critical care geared that our students can still graduate and work in the field if that's not really for them. They also can go into rehab facilities. So we have a lot of rehab facilities in our area that take long-term care patients, or they might be working with just rehab patients. So there's a lot of opportunity and variability. After our students gain experience after graduation, they are able to move into even more specialized areas. A lot of our students are able to go into physician offices These jobs are a little bit harder to come by. The benefit is it's more Monday through Friday, 9 to 5 type hours. So that's why they're a little bit more hard to come by, because when they do pop up, they do get scooped up pretty quick. So they can work in pulmonary clinics. Within a pulmonary clinic, they would be able to conduct specialized testing, such as pulmonary function testing. That's going to be a test that would tell us an individual's lung function. It's going to help us diagnose and monitor the pulmonary disease progression that patient has going on. They're able to be employed by different private entities, such as pharmaceutical companies, medical equipment companies. And what happens in those roles, they'll become experts on either a product line, if it's more of like a product company, or they'll become an expert on a medication, and they'll become trainers or educators to take that information from the company back to our hospitals, respiratory, nursing, whatever team might need that education. That is going to require experience at the bedside in order to be well qualified in order to be able to move into that area, but it's still another area they can move into. We also have a huge calling for home health. So these are patients that are getting discharged with different respiratory modalities. Their orders will be sent to a home healthcare company, and maybe it's a ventilator, or maybe it's oxygen, or it might be like CPAP or BiPAP. But a respiratory therapist will go into that patient's home and educate them on that equipment, educate the family, and get them set up. So there's a lot of really awesome, different, unique opportunities with respiratory for students that are wanting to go into respiratory, but maybe don't know if the hustle and bustle is the right fit for them. They'll have to do clinicals, but once they graduate, they really can select that niche that they feel is their best fit.
Awesome. I like how you mentioned too the different types of facilities, because going into it too, I know when I was doing a little bit of research on the field, I saw a lot of hospital opportunities, but like you mentioned too, for someone a little bit further in their career path, something like a rehab facility, pharmaceutical, home health. So there's a lot of different opportunities, for students down the road too, once they gain experience. But what I also found really interesting was that, there is that direct path right after graduation that a lot of hospitals, after that orientation phase, you really get to hit the ground running. So that tells me that COD really helps prepare students to really start off in the field on a strong note with pretty minimal training thereafter.
Absolutely.
What skills or strengths do students gain when completing the program or after they've graduated?
That is a really great question. What we have really been honing in on with our students actually came from information from career services. It was different information that different employers were surveyed to find out what are our graduates coming out strong in, and what were you wishing you were seeing them coming out stronger in different areas. Our program has always had a huge emphasis on communication, teamwork, critical thinking. But the study that came out showed that our students were coming out really well prepared with technology, but we're sometimes struggling with communication, professionalism, critical thinking. And we've always had a strong emphasis in those areas, but we're hitting those areas even harder to make sure our students are coming out to be well positioned for what their employer is going to be looking for. So what our main goal is, when our students have graduated, we want to create really strong critical thinkers and excellent communicators. Our job is going to be heavily bedside focused. We want to prepare our students to be critical thinkers so they're able to help those patients to help for best patient outcomes. At the end of the day, we are there to serve our patients, and we want to make sure that we're doing everything in our power to ensure best patient outcome and safest care. Our students are going to be prepared to take care of a patient that's experienced a medical emergency. So that could be an actual full code where maybe their heart stops beating and they don't have any respirations. They might be taking care of a patient that maybe has a heartbeat but isn't breathing. We would call that a respiratory arrest. They're going to get called to rapid responses. So this is a patient that had a change in their physical status, and we're going to bring a physician, the charge nurse from that floor, the patient's nurse, lab is going to come, respiratory is going to come, and we're going to be doing a head-to-toe evaluation on that patient and treating them as quickly as we can, again, to help with patient outcomes. A lot of our hospitals will have respiratory-driven protocols where we're going to be the ones deciding how to manage that individual's breathing status. We will either order or modify the different medications that we provide, along with what we call bronchial hygiene or lung expansion. Bronchial hygiene is working to get mucus out of the lungs, break it up and get it out of the lungs, along with making sure their lungs are staying nicely inflated. So what we'll be doing is managing their actual order set to make sure that we're providing the best care to hopefully get them out of the hospital as efficiently as possible. We place a huge emphasis on communication. Healthcare is going to be a team dynamic, and we all need to communicate often and clearly for best patient outcomes. So we work with our students to ensure that the students feel comfortable speaking up in uncomfortable situations, along with learning how to communicate without raising tensions in a really stressful situation. Knowing that a lot of the work we do is in ICUs or NICUs or PICUs or ERs, there's a lot of people in the room, sometimes family members, and we want to make sure that we're always being respectful, clear with our communication, and asking the questions that are important to be asked, which comes back to that critical thinking piece. So we really work hard on critical thinking and communication, and that overall will then help the overall student become more professional as well.
Wonderful. I know I heard communication, critical thinking, professionalism, and our listeners are definitely no stranger to that because we talk about those three competencies all the time. Those are actually three of the NACE competencies, so the National Association of Colleges and Employers. They've did something very similar to what you did of surveying employers that hire entry-level talent to try to see what the top competencies are that they look for in entry-level talent. And those are three of the top ones that consistently come up. And I can see how those would definitely play into the respiratory care field of having that strong communication, that critical thinking, whether you're in a hospital setting or just the medical setting in general. It's going to be very important when you're working with multiple parties. Are there any different experiences or opportunities that you recommend developing professionals seek out?
Absolutely. So I'm thinking of our students that are maybe coming into our program. Our program is laid out really unique. A lot of our health and science programs are laid out in similar formats, but our students are going to have lectures where we give the theory and the ideas of why we do what we do, and we build on that. But then we also have a lab component. Most of our lectures will have a lab component. Within the lab, we're going to practice the skills that they're going to be performing at the patient bedside. We have open lab hours that our students are able to come in and practice outside of lecture and lab time. We also have a tutor for the tutoring program. We don't have it for all of our courses, but we have it for our lectures that we deem to be really heavy content. We encourage our students to use that tutor as much as possible. It's like a group tutoring session. It's a really unique opportunity that we have to help increase student success. These are things that are newer to our program within the last 3 to 5 years. They're just so invaluable to student success. So taking advantage of all of the resources that are available to them is going to be really important. The lab is actually going to prepare our students for a diverse set of clinical rotations. So our semester 1 is heavy in content because in semester 2, they go right to the patient bedside. So in semester 2, they're going to actually be going into clinicals where they're going to be working typically on general medical surgical floors and sometimes the emergency department, depending upon the hospital. In this area, they're going to be learning and doing the hands-on to feel confident with patient assessment, patient interview, getting that baseline of the patient. They're going to be responding to rapid responses. They're going to be going to airway emergencies. And then in semester 3 and 4 of our program, they will do some ICU and some emergency care if they didn't do it in semester 2. The ER rotation might fall with general medical, or it might fall in ICU, depending upon the hospital. If it's one of our bigger academic hospitals, the emergency department rotation would probably fall in semester 3 and 4 because they get critical patients rolling in pretty consistently that are intubated or getting intubated. So they would consider that more of an ICU rotation event then as well. The importance with the ICU rotation then is that's where our students are going to learn ventilator management. So a ventilator is when a patient has that breathing tube put in their mouth. Some people know it as life support. But that tube in their mouth, we call it we would say that patient is intubated. That patient is going to be having the ventilator controlling everything that happens with them. So our team will set up that ventilator and we're going to do all the adjustments on that ventilator And again, depending upon the hospital, we might even manage the changes on that ventilator with protocols that are set in place. We work on weaning that patient to get that breathing tube out. And we're going to be doing a lot of intubations and extubations in that area. And then in semester 5, which is the semester that our students would graduate in, they get introduced to the neonatal pediatric units. And that's going to be anybody that wants to specialize in that area. We really encourage them to pick one of our really busier hospitals or a freestanding NICU-PICU to explore that a little bit deeper. They get to go into a pulmonary function lab and see how PFTs are run. They get to do a sleep rep rotation along with a physician office rotation. Each setting that our students will go to is going to help build a different skill and make them a more well-rounded individual in that area. And as we talked about earlier, communication is going to be a really huge key part of success for any healthcare field. With our clinical hours, our students, we hope by the end of it, are going to learn how to collaborate with the physicians, the nurses, physician assistants, speech pathologists, nurse practitioners, because at the end of the day, we're all part of the team that takes care of the patient to help them get better as effectively and efficiently as possible.
Awesome. Thank you, Christa. You gave some great examples of ways to get some additional practice or support, both in the class time and even outside the classroom. So I'm sure that's going to be very helpful for students, especially ones that are entering the field. What are you doing in your program at College of DuPage to prepare students for the field?
So earlier, we talked about the access our students will have to open lab. We have a specific respiratory tutor for some of our respiratory courses. In addition, we encourage them to use career services. We have, I forget what it's called. I think it's called the Task Center now, but we have an area that students can go to for general help with math and reading and writing. So we have a lot of really awesome resources right at COD. A lot of our lectures include a lab component, and that's where we get to work with our students in smaller groups to teach and reinforce the theory from lecture and prepare them for clinical. Our labs are typically about 8 or 9 students, so we're able to focus more one-on-one attention, and our labs are anywhere from 2 to 3 hours with the students. So our students are going to have advanced clinical rotations, and I talked about that a little bit earlier, where they get to do all of the stuff that we've talked about in lecture, and then we practice in lab. They get to do that hands-on in the clinicals. We have incredible simulation equipment at College of DuPage in our department as well. So we have an adult simulator, a pediatric simulator, and a newborn simulator. And depending upon what course, we will use any of these simulators, and we're able to, in real time, create patient scenarios to have the students start really thinking, what is it going to look like at the bedside? And they get to do that assessment. Our simulators have breath sounds so they can listen and determine, is that patient wheezing or do they sound really coarse? And depending upon how those breath sounds are, will determine what medication we want to provide or what type of therapy we want to give. Our simulators, the adult simulator can talk. Our pediatric and newborn simulators, they can cry, they can hiccup. All of them can move. When they're breathing, they get chest dry. So it's a really awesome opportunity for our students to get that hands-on care and really get an idea of what it might be like at the bedside before they actually get to the bedside. We're really fortunate to have all of that equipment.
That's wonderful. I know when I've walked through the Health Science Center, there's some really awesome simulators, and you get to see students working hands-on with it. And it's cool to see that tier 2 that there's multiple age levels too. So that students who are wanting to enter the neonatal unit or working with adults, there's something for each of them. And then, of course, services outside the Health Science Center too, career services, the tutoring and academic support center, like you mentioned, TASK. Great resources as well for students to help, really round out that education experience. Is there anything else you recommend to students or young professionals to help prepare them for the field?
I really just want to hone in on teamwork, communication, critical thinking. Those are really just such important things. Teamwork is one of the most important things I can think of. When we're in a high stress situation, it's important that we keep our cool. We don't let our anxiety get the best of us, because if we're getting anxious, we're not going to be able to respond appropriately to that medical emergency. We're not going to be able to communicate effectively with the team. And if we're letting ourselves become anxious, we're not going to be able to critically think in that moment either. So in those high stress situations, we're really looking for our young professionals to work on being able to relax and think of the patient first and what we need to do to help our patient best in that situation. And then being receptive to feedback. In healthcare, there's a lot of feedback that's given, and sometimes it feels like you might be being attacked or that there's a punitive measure that's going to happen, but it's really only to help our individuals grow to provide best patient care. So being receptive to feedback and not shutting down is going to be a really key to success.
Thank you. It's helpful to hear too how it plays a part in the hospital setting or in the respiratory care field. I know the being receptive to feedback, it could be a tough thing, but when you're thinking about how it's really helping your bedside manner, it's helping, your patient care, how it's helping family members feel more at ease too when you're working with them and with their loved ones. So I love how you put that in perspective and can turn it from something that could maybe be worrisome for some to something that can really be a positive experience and help you grow as a professional. Excellent. And my last question here is, how can interested listeners learn more about the program here at COD?
Our students can go to our COD website and search for our program, or you can even just go to any search engine and put in Respiratory Therapy, College of DuPage, or COD Respiratory Therapy, and it's going to take them right to our program page. Our program page is, I feel, really easily laid out. They're going to be, if they're on an actual computer or PC, they're going to be able to go to the right-hand side of the page, and about halfway down, there is a block that says Respiratory Care Application Packet. And when they open that packet, it gives a step-by-step of what has to be completed to have a successful application. What does the program layout look like? It gives my contact information, my partner's contact information. If they're searching from their phone, it will be at the very bottom of the webpage. It will come up. But it's a wealth of information. Within that application packet, there's going to be a hyperlink to all of our advising sessions. We hold monthly advising sessions where we go over everything from the application requirements, the program layout, what do clinicals look like, what days of the week are clinicals on, to help the student feel really prepared that once they apply, they feel that they will be successful with the program based off of the layout, the commitment of hours to school and whatnot.
Excellent. Yes, the program pages at College of DuPage's website are wonderful, and I love seeing that application packet too, and knowing that, there's a time each month that you can go in, ask your questions, learn more about the program to really get a better understanding. But hopefully now our listeners can get a little bit of understanding of the program even before attending something like that. So thank you again, Christa, for sharing all this great information today.
Thank you again for having us. We're very excited to share everything about our program, and we hope to see lots of applications come through.
Thank you. With today's episode, there is no listener questions. However, if you have a question, you can submit it to careerpodcast@cod.edu or on social media at COD Career Center, and you may hear the answer in a future episode. Thanks to all of our listeners, and special thanks to Christa Brennan for joining the Career Ready podcast. We hope you now have a better understanding of the respiratory care field.